Ready to make a change in your life and your body? You need to come here to Zavala, where cosmetic surgery is more than just looking good. It's about healing and transformation. We're here now with founder and cosmetic surgeon. They call him Dr. Z. Thanks so much for talking with us.
Thank you, Destry, for letting me be here with you.
Yeah.
Appreciate it very much.
Well, why don't we share with everyone what makes Zavala different than other cosmetic surgery centers?
The main thing is I don't consider this just to be a surgery center. I really think that this is a place where we play a lot of emphasis on the patient's well-being, not just their cosmetic result, that is obviously a paramount importance for us, but also their transformation into what they feel they look now with their new transformation, and the way that they can increase their health span, improving their lifestyle. And we follow that very closely because I think that is very critical for a doctor, not just to look at the cosmetic part of their procedures, but also at the quality of health that their patients have.
Well, you say changing your appearance can also make a huge difference in your confidence.
I consider this like the spark that lights the fire. I really see these patients that we see here, many of them very metabolically damaged, very obese, diabetes, high blood pressure, chronic medical conditions, and making them change just cosmetically. Yes, it creates a sense of well-being in them, but if you pursue that with coaching them into changing their nutrition, their exercise levels, their hormone levels, their lifestyle in general, makes them really change into the person they wish they always had before. It's not just pushing pills like sadly traditional medicine is always doing. It's like changing their people's self-identity that they can now look in the mirror and be happy with. What
do you see with your patients after they get that spark?
In those that follow our recommendations thoroughly, that is not all of them, but a good percentage, I would say 60–70% of them, when they look in the mirror after their change, after the surgery, sometimes they have tears in their eyes. It's something that they see a different person now, one that they wanted to become, one that feels right in their own skin. And that makes them really eager to follow our recommendations in regards to their lifestyle. And we coach them with what nutrition to follow, not what the many dietitians tell them, but the reality of what nutrition should be, the type of exercise they should follow. For example, the older you get, the more importance it is to do resistance training, not just cardio. All that together with making them sleep better, get socially more involved, get better in regards to the hormone stability, makes a total transformation in them. And you can see a patient that was really going downhill to now being a new you.
Yeah, and you actually have an example of that. Why don't you tell me about that?
Well, I have multiple examples. One of them that allowed us to show her pictures is a lady that was 65 years old when I first treated her. She's now 67, morbidly obese. We did her lipoabdominoplasty. We never do simple tummy tucks. We do a very thorough procedure where we change their shape.
It's amazing.
And she followed my advice in regards to the lifestyle changes. And she goes hiking every single day now. She has lost even more weight. She has no more diabetes, no more high blood pressure, no more depression, no more back pain, knee pain. She's a totally new person, and she's eager to do that. And the beautiful thing, when people close to them, their family, their friends, look at their transformation, creates kind of a domino effect when the rest of the family starts to see that they can also do something.
Family.
So it's an amazing endeavor.
You actually call it resurrection medicine, and you're writing a book on this. Really quick, explain
Well,
that.
the book is done. We're waiting for the publisher to finish. But the reality is resurrection medicine implies not that we're bringing you from the dead, from the ground, but from the dead inside your life, that you are not really completing it to your whole potential. When you reestablish the patient's self-image, their improvement in the way they look at themselves in the mirror, and then help them with changing all the other parameters we discussed, really they come back to life, real life, not just the usual depressive lives that we're following.
And you do so many different procedures here, and you can find those online and learn more. All you have to do is go to Zavala cosmeticsurgery.com.